Imagine a fight inside your body where your cells turn against you. This is the grim reality of blood cancer. Within the vast realm of diseases, blood cancer or hematologic cancer stands as an ominous condition. It is characterized by the uncontrollable growth of abnormal blood cells. These rogue cells disrupt the function of normal, healthy cells, hindering our bodies from performing vital tasks such as fighting off infections or preventing serious bleeding. At the heart of blood cancer, there are three main protagonists: leukemia, lymphoma, and myeloma. Leukemia, a traitor in our blood system, targets our white blood cells. Lymphoma, on the other hand, infiltrates the lymphatic system, the body's defense mechanism. Lastly, myeloma is a silent assailant, affecting plasma cells in the bone marrow, the very foundation of our blood cell production. Understanding these cancers is crucial, as early diagnosis can significantly improve outcomes. Leukemia, the cancer of the blood-forming tissues, is an invader that targets your white blood cells. This insidious attacker can manifest itself in two main forms: acute and chronic. Acute leukemia is the equivalent of a blitzkrieg, a rapid and often unexpected onslaught. The symptoms of this type of leukemia appear quickly, leaving no room for doubt that something is amiss. Individuals battling acute leukemia may experience a sudden onset of fatigue, finding themselves drained of energy, even after a good night's sleep. Simple tasks may become Herculean challenges. Alongside this fatigue, easy bruising or bleeding can be a telltale sign of acute leukemia. A slight bump or scrape may result in a bruise, a silent reminder of the battle being waged within the body. Also, frequent infections, once a rarity, may become a common occurrence. On the other hand, chronic leukemia is a different beast altogether. This form of leukemia is more akin to a slow, creeping invasion. Unlike its acute counterpart, chronic leukemia progresses slowly, silently infiltrating your body. The symptoms of chronic leukemia can be so subtle that they may be dismissed as the result of a busy schedule or aging. However, these seemingly innocuous signs should not be ignored. Chronic fatigue, unexplained weight loss, and recurrent infections are all signals that your body may be fighting a battle against chronic leukemia. Remember, these symptoms are not a definitive diagnosis, but rather red flags indicating that something may be amiss. If you or someone you know is experiencing these symptoms, it is imperative to seek medical attention. Leukemia, often silent and insidious, demands our attention for early detection and treatment. By understanding the signs and symptoms, we can arm ourselves with knowledge, our first line of defense in the battle against this formidable foe. Lymphoma, another form of blood cancer, takes the battle to your lymphatic system. Lymphoma is that uninvited guest that makes itself at home in your lymphatic system, a network of tissues and organs that help rid the body of toxins, waste, and other unwanted materials. It's a part of the body's immune system, and when lymphoma strikes, it's the body's own defense system that is under attack. Now, there are two main types of this infiltrator: Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma is like that one infamous villain that everyone has heard about. It's characterized by the presence of a specific type of abnormal cell, the Reed-Sternberg cell. Non-Hodgkin lymphoma, on the other hand, is a collective term for a group of lymphomas that do not have this specific cell. This distinction is quite important because it helps doctors determine the most effective treatment strategy. But the commonality between these two types is that they both lead to the growth of abnormal lymphocytes, a type of white blood cell, which can form tumors in parts of the lymphatic system, such as the lymph nodes. Now, let's talk symptoms. What are the telltale signs that lymphoma might be knocking on your door? Swollen lymph nodes are the most common sign. You might notice lumps in your neck, armpits, or groin, but lymphoma doesn't stop there. It can bring along fever and night sweats, making you feel like you're caught in a never-ending flu season. But remember, these symptoms can also be caused by conditions other than lymphoma. So if you're experiencing these symptoms, it doesn't automatically mean you have lymphoma. However, it's always a good idea to seek medical advice if you're feeling unwell or notice any changes in your body. Awareness of lymphoma symptoms can be the key to unlocking early treatment options. And early treatment is crucial in turning the tide in this battle against lymphoma. Myeloma, The third main type of blood cancer wages war on your plasma cells in the bone marrow. This insidious disease conducts its battle silently, striking at the very foundation of your body's immune system. Plasma cells, you see, are the diligent soldiers of our bodies, producing antibodies to combat infections. But when myeloma takes hold, these cells are compromised, causing a cascade of damaging effects. One of the primary battlegrounds in this war is your bones. Myeloma cells, in their relentless growth, begin to crowd out healthy bone cells. This can lead to areas of weakened bones, leading to painful fractures and breaks. But the onslaught doesn't stop there. These rogue cells also produce a substance that stimulates other cells to break down bone, leading to further damage and pain. It's a ruthless cycle, one that leaves your bones vulnerable and aching. Yet the kidneys, too, are not spared in this warfare. The myeloma cells produce proteins that can be harmful to your kidneys, leading to potential kidney problems or even failure. This is a silent battle, often with no early warning signs, making it all the more crucial to understand and recognize the symptoms. Speaking of symptoms, bone pain is a common complaint in myeloma. A persistent pain, often in your back or ribs, that doesn't go away with rest. Another sign to look out for is hypercalcemia, a condition characterized by high levels of calcium in the blood. This can cause excessive thirst, frequent urination, constipation, and even confusion or lethargy. These symptoms might be subtle. They might be dismissed as just signs of aging or overexertion. But they are your body's call for help, a signal that something is amiss. Understanding these signs is the first step in recognizing the silent war that might be taking place within your own body. Though myeloma is a formidable opponent, knowledge of its symptoms can lead to early intervention. And in this war, early intervention can be the key to turning the tide, to taking back control, and to ultimately winning the battle against myeloma. Blood cancer does not discriminate, and even the smallest among us are not immune. It's a harsh reality to confront, but children, like adults, can and do get blood cancer. The most common types striking children are leukemia and lymphoma. Let's delve a little deeper. Leukemia, a cancer of the blood cells, tends to be the most common cancer in children. It occurs when the bone marrow produces abnormal white blood cells, which then crowd out the healthy cells. This can lead to anemia, infection, and easy bleeding. There are two main types of leukemia in children: acute lymphoblastic leukemia, which is more common, and acute myeloid leukemia. Lymphoma, on the other hand, primarily affects the lymphatic system, a vital part of the body's immune system. In children, it usually manifests as non-Hodgkin lymphoma, which can grow quickly but often responds well to treatment. Symptoms can include swollen lymph nodes, fever, and night sweats. The symptoms of these cancers in children can be vague and similar to more common childhood illnesses. This is why it's crucial for parents and caregivers to be vigilant and seek medical attention if symptoms persist. The good news is that with advancements in medical science, the survival rates for these cancers in children have improved significantly over the years. Treatment options are continually evolving, and they typically include chemotherapy, radiation therapy, targeted therapy, and sometimes stem cell transplantation. Remember, early detection in children, as in adults, can significantly improve outcomes. It's a journey no one should have to embark on, but knowing the signs and acting swiftly can make all the difference in the world. The battle against blood cancer hinges on a critical factor: time. The clock starts ticking the moment abnormal cells begin their rampant growth. This underlines the importance of early diagnosis in the fight against blood cancer, be it leukemia, lymphoma, or myeloma. Early detection provides the best chance of successful treatment, as it allows medical professionals to intervene before the disease has advanced significantly. The symptoms of blood cancer, such as fatigue, fever, or swollen lymph nodes, may seem common, mundane even, but their persistent, unexplained occurrence can be the body's cry for help, a sign of the unseen chaos within. Ignoring these signs can lead to delayed diagnosis and, unfortunately, a more challenging battle. Treatment options, too, are most effective when initiated early. They range from chemotherapy and radiation therapy to stem cell transplantation and targeted therapies. The earlier these are started, the better the chances of controlling the disease and improving the patient's quality of life. Remember, the sooner the detection, the better the protection. Now it's time to address some of the common questions you might have about blood cancer. Firstly, what are the risk factors for blood cancer? The risk factors vary for different types of blood cancer. For leukemia, common risk factors include exposure to high levels of radiation, certain chemicals, and chemotherapy drugs. Genetic factors also play a role. For lymphoma, risk factors often include a weakened immune system, certain viral and bacterial infections, and exposure to certain chemicals. Myeloma risk factors include age, male gender, African American ethnicity, obesity, and a family history of the disease. Please remember, having these risk factors does not guarantee you will develop blood cancer, but it does increase the likelihood. Next, how is blood cancer diagnosed? Diagnosis often starts with a physical exam and a discussion of your medical history. Your doctor may also order blood tests, bone marrow tests, and imaging tests to confirm the diagnosis. In some cases, a biopsy of the lymph nodes or a lumbar puncture may be needed. These tests can help determine the type and stage of blood cancer, which is crucial in planning the best course of treatment. Let's move on to what are the treatment options for blood cancer. Treatment strategies can vary significantly based on the type and stage of your blood cancer. The primary treatments for blood cancer are chemotherapy, radiation therapy, and stem cell transplantation. Chemotherapy uses powerful drugs to kill cancer cells or stop them from growing, while radiation therapy uses high-energy radiation to shrink tumors and kill cancer cells. Stem cell transplantation replaces diseased blood-forming cells with healthy ones. In some cases, targeted therapy or immunotherapy, which boost the body's natural defenses to fight cancer, may also be used. It's important to discuss with your healthcare provider to understand the best treatment options for your specific situation. Finally, what is the survival rate for blood cancer? Survival rates depend on many factors, including the type of blood cancer, the stage at diagnosis, the patient's age and overall health, and how well the cancer responds to treatment. For example, the 5-year survival rate for people with Hodgkin lymphoma is about 86%, while for non-Hodgkin lymphoma it's about 71%. The survival rate for certain types of leukemia and myeloma can vary widely. Remember, these are just statistics. Everyone's journey with blood cancer is unique, and advancements in treatment are constantly being made. With knowledge, we become empowered in our fight against blood cancer.